If you're listening to this, you lived through the COVID pandemic lockdown and can probably remember being confused about the information coming out when it all started, about whether or not we needed masks, if we should be washing our groceries, and even about the illness itself. In this episode, my friend Chanapa Tantibanchachai talks about being in the thick of it as a press officer for the U.S. Food and Drug Administration, or FDA, and the complexities of communicating health science at that level. This was Chanapa's dream job, but unfortunately, at the time of this interview, Chanapa had been laid off. Earlier this year, after just 5 short years at the FDA, hers was one of hundreds of positions eliminated from the U.S. Department of Health and Human Services as part of the incoming administration's sweeping reductions in workforce across the federal government. When I talked to Chanapa, this was all still very fresh, so in this episode, you'll hear about her experience grieving for her dream job. But you'll also hear about what a press officer at a federal agency like the FDA actually does, and why science is often misinterpreted by the media. Here's a hint: scientists and journalists basically speak different languages. You'll hear the human side of science communication, the personal story that shaped Chanapa's career, inspired her to serve her country as a civil servant, and why these behind-the-scenes roles impact every American every day. If you ever wondered how public trust in science is built, or why it sometimes breaks, you're about to get an inside look on this episode of Blue Collar, White Coat. You're listening to Blue Collar, White Coat, the only podcast bringing to life the human side of STEM, one unglamorous but essential job at a time. Chanapa, thank you so much for coming on to Blue Collar White Coat. I'm so excited. Can you give us an introduction, who you are, what you do?
Yeah, thanks for having me. No, so my name's Chanapa Tantibanchachai. I would call myself a health science communications pro, with my focus areas kind of being media relations, crisis comms, and public affairs. I was most recently a press officer at the FDA, sort of Food and Drug Administration for the federal government, until April 1st, when I got affected by the mass layoffs, or you probably heard them in the news, called RIFs, Reduction in Force, brought upon by Elon Musk. So right now I'm in between jobs, as they say. I am not working.
Yeah, but you've been doing a lot of soul searching and like I love that for you, because this was your dream job, right? Like, this is something that you worked really hard at to achieve and we're doing big things at. And so I'm really glad to see you taking time and like mourning, like a lot of people don't think about grieving or mourning when it comes to jobs, but it's like that was a place you were really happy, you were doing good work. And grief isn't just for like death, it's for big transitions in your life too. So I'm really glad to see that you've been taking that time for yourself and kind of, like you said before we started, figuring out what comes next and kind of what that looks like for you. So good job from one friend to another.
It's still a process. I think I didn't let myself even think about grieving properly for the first couple of months. I was like in a manic state. I felt like there was so much pressure to try and network and get a new job. And, there was so much momentum in the news about what happened. So I was trying to like keep up with that. But no, this past month I've been like actually taking time to process what happened and letting myself feel the feelings. Cause you're right. It's like losing your job sucks, but then it's like
Right.
my whole team was eliminated. So it's like the idea of I'll never work with these people again. The team, what we had just disappeared.
Just gone the next day. And I know you've been talking a lot about like, not only are you out of a job, you're basically competing with your former colleagues and best work pals for these other jobs. And it's not just your team, it's thousands of other government employees who were let go at the same time.
The
like
same
out
time
in the job
with the
market.
same skill set. I have never seen so many just, health communicators, health comm strategists, like people with it could be the same resume as me posting these like very sad, I'm laid off LinkedIn posts. And I was like, great, there's another, person that I feel so sad for, but is also now my competitor.
Yeah. Yeah. Wow. What a complex field of emotions to navigate. And like, it's cool that you're not alone in it, but also that's the worst part in a way. Gee,
Right,
I
actually,
can't
yeah.
imagine.
It's hard to really put words to because it's like
Yeah.
the shared horrible like once in a generation experience.
Yeah.
So, there's camaraderie there, but it's also like, why is this happening to us? Yeah.
Yeah. And once in a generation job too. Like these jobs, and I think that's like one of the things that I really want to speak to here is there's this misconception, the stereotype that government workers just collect a paycheck, they just go for the benefits, and and there is waste, fraud, and abuse in the government, like absolutely there's 100% too much money being thrown at people to do too little.
Uh-huh.
But every person that I know, and I know a lot of government workers, they're they worked their tails off to get into those positions, first of all, because somewhere along the lines, the requirements to get government jobs just like skyrocketed. Like you can't just, no, but the average Joe can't just like waltz into these positions. And that doesn't matter if you're a maintenance person at a national park or a press officer at the FDA. And it's heart-wrenching to think of how much work you and others put in to even get these positions in the first place, let alone, the kind of work you were doing is important for everyone, and you signed up for that job for a reason. It wasn't just for like the, benefits.
Right. No, absolutely. I signed up. I started in August 2020. So I started during the pandemic and I wanted to because there was such a time where, I mean, everything was so new. We didn't have any vaccines or treatments, anything yet. No one knew what was going on. Like every second of the day, right? Like public health and the messaging was evolving and people needed that information. And I wanted to be part of sharing that information and being like a reliable source to the media and to, the person on the ground that eventually reads a reporter's story that I helped make happen. So yeah, no, it's really important work and I think it'll be hard. Well, a lot of us, it'll be hard for us to find work that meaningful on a national, like honestly, like
Yeah.
international scale again.
Yeah, I mean, geez, the pandemic, that time, I think that was where it was crazy because I had just graduated in 2019 with my science communications master's, and I was looking around like, this is why what are we doing? What a mess. Like, you need masks. You don't need masks, uh, whatever, like all of the confusion that was coming out. And a lot of that was due to the administration's lack of preparedness at the time. But like in general, there was the sense that like the scientific community was doing itself no favors with the trust that the public had in it by
Yeah.
the kind of back and forth and the unsureness and communicating like, hey, there are a lot of things here that we're learning as we go, we don't know, and being afraid to kind of be that transparent and say like, hey, we're figuring it out, we're trying to get you the information as we come across. So you're right. Like, I love that you had that kind of like, hey, I have the skills for this. I know exactly like where I stand and like how I can help in this situation. And like getting that call or that email that you got that position must have been like, oh my God, I can't even imagine.
It was unbelievable. I think even now, looking back at the almost 5 years I was able to be there, it was a good run. Some days I woke up like, I can't believe they let me do this job. Little
Right?
old me.
Oh, I love that. And we'll talk about that actually in a little bit. And that's actually how we met the job before that job, right? You were at Johns Hopkins University. I was a communication specialist with within the engineering school, and it was so funny because like you and me were not in meetings together. I think you started responding to the like Instagram account stories that I was posting for my department, and then like we did see each other at a big, I think, social media meeting or
Yeah,
something like
eventually
that.
some big meeting. We just hit it off.
It's funny how I have to take breaks and I have to like keep my mental health in check when it comes to social media, but I also am so grateful to it for so many reasons. And one of those reasons is like it brought us together and it kept us kind of in contact in the last 5 or so years. So that's
Yeah,
pretty funny.
absolutely.
So, okay, before we get into what you did at Hopkins, how did you get interested in the health sciences? How did you get transitioned? Like, were you always interested in being a communicator, or were you more interested in potentially being like on the research, like, lab side of the health sciences? Or how did you find that?
Yeah, no, so it's started off in the sciences, thinking, I would get a degree in biology, go to med school or pharmacy school, just follow like the path that I understood, and largely for like stability. I
Hmm.
think, I have immigrant parents, and like a lot of immigrant parents, they view like stay in a STEM field, become a doctor, become like a healthcare professional of some sort. Like, so I was like, okay, I'm all right with science. I like it enough. I'll go major in biology and, take it from there. And so I went through, college, but doing it, and I think I got to organic chemistry. Like a lot of people weeded me out. I was like, I can't live like this.
That's so funny. I feel like I need to have like an interview bingo card because you're you're only the like fourth or fifth interview I've done, but you're not the first to mention organic chemistry. Like it's like Mean Girls, like raise your hand if you've been victimized by organic chemistry.
Yes, me. But no, but I always, throughout all of that, and like my like academic searching and career searching, I always loved to write. So once I gave up on pharmacy school, medical school, just any continuing school, well, I went and did my master's. So I stayed and did like an accelerated master's program
Okay, cool.
where it was like an extra year, and I got my master's, and I started applying for basically any science comms job that was
Hmm.
available. And so I
Which
like
was weird. It was like not a thing
no,
then.
I think it's more
Like
the thing now. I think it's
yeah.
definitely more recognized. Like, how do you even search for, a job that you would be interested in when you don't know what it's even called, or when you, what the possibilities are?
Oh, yeah. You grew up in Arizona then.
I did. I grew up in a small town called Bullhead City, Arizona. It's like right on the like kind of state line between Arizona and Nevada. I knew I always wanted to like leave town because there weren't that many opportunities there. And like a lot of immigrant parents, they instilled in me the idea that like education is the way you're gonna, be able to make it out of here and create the life that you want. So I took that very seriously and was like a straight A student my entire life. Probably looking back, I'm like, I think I could have gotten a B and still been fine. Could have unclenched a little, but
Right. Go-
now I tell my little cousins that, or if I run into the kids, I run into younger people, I'm like, you have your whole life to live. Like you're gonna work. One day, don't
Yeah.
worry, you'll be an adult, but you don't have that much
Yeah.
time to relax and be young.
Uh,
There was one major thing that I think really was like a huge seed for my future is I was really close with my English teacher, as a lot of dorks in high school tend to be.
Shout out English teachers.
English teacher or like the kind art teacher is
Yeah.
where you gravitate to.
Yeah.
But my English teacher, Kevin, he had like kind of a partnership with the local little town magazine. It was called Our Town, and every year he would have a senior or two. I forgot what the deal was, but we were basically got to be like journalists for them, and interview, people in the community, and then write an article. I think it was like every month I wrote one. Just like a profile piece on a pillar of the community, like a business owner. And it would get published in Our Town magazine. And I think that gave me a lot of the skills that I ended up using later, speaking to researchers and scientists, kind of drawing out their story. So that experience did a lot for me.
In a newspaper scenario, you're talking to all kinds of people. I'm sure you have to jump from like talking to the baseball coach this week, and then next week we're talking to this, diner owner kind of thing. That kind of give you, you think like I don't know, like an edge in terms of how to kind of calibrate your approach to different folks.
Yeah, absolutely. That's so funny because I was just gonna say that's exactly what it did. I think it taught me how to like read the room, right? Like to go in and sense like, oh, is this person going to be more receptive if I joke a little, or are they very serious? And I had to, just kind of keep it all business with, relationships with the SMEs, the subject matter experts, all the scientists at Hopkins or the FDA, and also with reporters, because you have to have relationships with the reporters too, and they're all different.
Ooh, I was just like, as you're saying this, I just realized that like those are two like very stereotyped groups, right? Like those two, especially right now, people want to put those folks in a box. Reporters are all shock, going for like clickbait. They don't really care if they get it right. Like that's what people, I don't know, this is a reputation, I guess. And then scientists are all cold and kind of they can't relate, and they've never had to do hard work in their life, and they're just the academic elite, if you will. I feel like right now, especially, and since the pandemic, maybe have been heavily scrutinized by a lot of everyday people, a lot of everyday Americans, especially.
I think it's real. You're so right. And I think a big part of that is like, whenever are you going to meet a reporter? Like, when are you going to speak, or are you going to speak to the head of a lab? Like, that's just not
Right.
someone you usually run into, or at least not in great
Like
numbers. Like,
knowingly, like they're not walking around with their like most of the time with their like press badge on, or their
right.
yeah.
I would just say from my experience, like, yes, some stereotypes, exist because there's some like a kernel of truth to them. Like, I've
Yeah.
definitely have dealt with a number of reporters that will like reach out for comment about something at like 5 p.m. Friday, and they say we're publishing in an hour. And I was like, okay, well, clearly you already have your storyline. You are, the whole thing's written already. You're not reaching out for a fair comment for both sides for nuance. You're reaching out to check off a box, but you've already made your conclusions. So that's like kind of unfair. That's, I would say that's kind of like unfair journalism, and that fits into what the stereotype we were talking about.
No, that's interesting. I would have never thought of that aspect. Like you already have your story, you're looking just for like a quote that you can then pop in to it.
Yeah, my previous job, like, oh, we asked FDA for comment. They did not respond. Well, I was like, well, maybe we didn't respond because you asked us at 5:30, or what on a
On a
Friday
Friday.
for something that, I don't know if people realize this, but because it's a regulatory agency, it's sometimes it just can't be a simple yes, no. It's, things do have to go through lawyers because they have like major implications on what, the answer is. And if we're putting it out to the press, if we're responding a certain way and attributing it to a federal agency, like we need the time to make sure that what we're saying is correct. And you would hope that the reporters would also want to give us the time to be accurate, and that the folks reading it can be sure that, it's been vetted. But that stuff takes time.
Yeah, no, I would have never thought of that before. So interesting. What about on the other side of the spectrum here with this group? Like tell us like a horror story about an SME, like a researcher, and then tell us like maybe like hopefully that's the outlier. I don't know. What
Yeah,
did you
yeah.
experience?
I was working with a researcher on something that, like a paper she was going to publish on her work, and it was about the heart. It was like digital models of the heart, looking at like kind of like the electric pulses and how to take that and hopefully someday predict what could happen to that heart in the future. So I suggested some headline like blah blah 3D model heart, virtual heart, and the researcher was like, "Well, we're only looking at the left atrium, so that's not accurate for you to say the heart." And I was like, okay, wait, yes, but like I just had to be like, I don't know if people know that there are four chambers in the heart, and I don't know if it makes a difference. You cannot put in a headline like left
Yeah.
atrium, right ventricle. What you lose people already.
Yeah.
Saying that you're looking at the heart is still accurate. You don't need to quite specify in the 4 5 word headline. Like
Right.
you can specify later exactly what you're doing, but like to achieve the goal of, communicating the research and getting people interested in what you're doing and letting, like taxpayer funded research. Having people understand what you're doing with their money. You do not need to work against yourself and lose them by using, terminology and extra detail that is not necessary right away. But they were very not receptive to that feedback. So that took some time to work that one out. So there's instances like that, right, with the
Right.
researchers. There's instances with the reporters where they're not good reporters or they're not being fair. But I would say by and large, like these are all just people too. Researchers and journalists themselves, like researchers can be very scared of reporters. And
Yeah.
sometimes reporters think that scientists are being intentionally like obtuse or hiding information. But a lot of times I work with these people as just bringing everyone together, being like, this is like a symbiotic relationship. We're
Yeah.
gonna benefit here if
Yeah.
you talk to the reporter like a regular person, you're honest, or if I could tell the reporter, hey, I need some more time for this article, like, and usually they're understanding and will extend a deadline for me if I tell them I'm doing it because I want to get them as thorough and accurate as an answer as possible.
Yeah. I love that. That's something like in my experience, I've also worked really hard with. You're exactly right. Researchers and scientific staff, they can be a little cagey because, like, and why wouldn't you be? Like, look at all the negative press that science, especially, like I said, since the pandemic, especially, but kind of always has gotten. And it's there's movies, right, where the scientists are up to no good, or science gets interpreted in the wrong way, and they that talking about your headline example, I've seen that so many times. And it's also because scientists are trained almost exactly the opposite way from reporters, where a scientific paper, you need to get as much detail in that title as possible because you're competing for things like grants and the attention of partners, potentially, even political, legislators. So you have to squeeze as much into that headline as possible so that there's an impetus to then read the paper. Whereas a headline in the press sense, you're competing with TikTok and people's kids running around and whatever else. So you have to make that headline as short as possible and get to the point so that there's, again, impetus to read the rest of the article. And if not, like, I guess the way that they trained me for press releases is like, okay, assume that somebody isn't going to read past the like third sentence, right? So what are you going to pack in that headline and those first couple of sentences that gets across the point? And then the rest of it is just a bonus. Whereas with scientific papers, especially, it's all context first. And then the point is all the way at the end in the summary
Yeah,
and the
it's like
like.
the inverted pyramid. And that's just,
Yeah.
I mean, like, I would not call myself a scientist having done like up to a master's degree in biology. That's like the science light, right? That's not,
Yeah.
I
Yeah.
didn't work in a wet lab or anything. But like, even the papers I had to read and write in that time, it's all like, tell us at the beginning of time what the background
Oh
of
my
this
gosh.
topic was and who has looked at these other angles. And finally, you're like, okay, and this is what I'm doing. But that
Mm-hmm.
doesn't work for of communications, lay audience, media
Right.
relations perspective.
Right. It's not a surprise that science is oftentimes gotten wrong by the press, and it's not a surprise that science is folks that represent science are oftentimes mistrusting of the press, and it's not always because there's malintent by either party. It's just
Oh
they speak
no.
two different languages almost, and there's not. I think podcasts like this, I think conversations like the one we're having right now, are the key to helping kind of I don't know, like get us through that, get us kind of past that like paradigm that's been accepted for so long.
No, I totally agree. And I feel like in my old jobs, being a press officer, a media relations person, you're kind of doing that same work. Like you're bringing, the scientists and journalists together. You're like, here's a different way to look at it. And then here's a way to engage. Like, where can we find common ground? And everyone walks away from this satisfied.
Yeah, I love that. And it's another reason I want to do this, because I think a lot of people, talking about common ground, a lot of people think that scientists, researchers, first of all wear white coats. They all have PhDs. They all, mom and dad went to MIT, so they got to go to MIT, and they were born with a pipette in their hand, or their first toy was a microscope or something like
Yeah.
that. And it's just not true. And like, to your point, yeah, you're not necessarily a scientist. I would argue that like 90% of the people in STEM try to like back away from the title scientist because they don't feel qualified to call themselves scientists or researchers or whatever. And that's usually because most people in the sciences and STEM in general are people that worked through college, or they like didn't have that, academic elite, like ivory tower kind of experience in school. Maybe they left their program and came back a few years later or something like that. So I don't know. Can you talk a little bit more about, how, yes, you have a master's degree. Yes, you have, a scientific background. Can you talk a little bit more about, your kind of path and how it might look different than people might think?
Yeah, for sure. So I mentioned my parents are immigrants from Thailand, and they actually decided to stay in this country for me because I have like a rare I have a rare blood disorder, and the
I forgot all
healthcare.
about that.
Yeah, the healthcare at the time when I was born, I had to get blood transfusions every 3 weeks and take specialty medication. So the access to that was a lot better back when I was born in the US. So my parents decided to stay for me. So no, it was, life was not easy. I did not, definitely not born with legacy parents. My parents went to college in Thailand and thought that they'd be able to transfer their skills here in the States. But like a lot of people, that was not possible. They would have had to restart school over here and pay all, US tuition dollars. So my dad was a casino card dealer. I mentioned that we lived on the border of Nevada.
Right. Okay.
So that was why we lived there. So we could cross the bridge, and then there was like a line of casinos where he could work. So he was the only income in our house growing up. So, low income.
I was gonna say, does that pay a lot? Because I don't know. You're the now second person I've met since moving out here, or talked to, I guess, that had a parent as a car dealer, and like
Yeah, yeah.
talked to, the, I guess, experience of that. Like, does that, I mean, it can't pay a lot of money, but maybe it can. Like, what is it? What is it like being a car dealer, I guess, from your...
It fluctuates obviously because of the tips and stuff, but he never made more than $35,000 a year. Yeah. And like 35 is like the top, like the like the year he's made the most. I think normally it was like closer to 30, like high 20s. Um,
Wow.
and I was an only child, so it's not like he had, we had a lot of siblings or something to take care of. But with still raising a family with a kid with a chronic illness, money was pretty tight. And I know my parents didn't have a support system, so they inadvertently put a lot of pressure on me. So I definitely knew the importance of, having money from a young age, and I knew that I wanted to get a job where I would not have to struggle the way they did. And, if I was lucky, a job where I could support them eventually too, which I've been able to do. I've been really fortunate to, make an income eventually that I could send money back to my parents because they're still struggling.
Yeah.
Yeah.
And they gave up so much to keep you here and give you everything possible, and the healthcare. I totally forgot. I know that you have this ongoing health condition, and I totally forgot about that aspect. Like, I can't imagine how scary that must have been for them.
No, I look back. I mean, even now, right? As like college educated, I had the financial resources. I still have health insurance, thank goodness, even though I was laid off. It's still hard. So I don't know how my parents did it with, English wasn't their first language, and they had to get through this medical jargon, talk to the doctors and nurses in this small town that had never seen a case like mine to advocate for all of us. There was a lot of racism too, a small town.
Yeah.
So I don't I don't bless them. I don't know how they did it, to be honest.
Truly, like that just seems insurmountable. And especially, what you mentioned about your parents having degrees and having been schooled and gotten educations in Thailand, and then coming here and the language barrier, time and time again, people assume if you don't speak English, it's your first day on planet Earth. You're dumb. You can't understand. They talk louder at you, I'm sure. Like
Right.
I certainly not something I've ever had to experience in my life, but I can't imagine going with my degree somewhere else and being treated like a second rate human being and having to get a job just to pay bills that I'm not really interested in, maybe, and like, maybe
Yeah.
feels beneath me or something like that. That
I
must
think
be.
about that all the time because now I'm past the age of where they had me. Definitely past the age of when they moved to the States. But I was like, if someone dropped me off in like Mongolia when I was 28, like, I don't
Right.
know. I would have just given up. I would have. I
Yeah,
don't know how they did it.
right. And it's certainly something that I think about a lot more now. During COVID, when there was mainstream news stories about prejudice and like horrific racism going on towards Asian folks and Pacific Islander, and just like because of COVID. And that was one of the points that I remember reading about, was like, just because someone's doing your nails doesn't mean they don't have a degree in biology from somewhere, or, you know, are are a whole person with a whole life and, wisdom and intelligence and education and whatever else from, where they came from, wherever, they had to start over here. That was kind of, unfortunately, I hate to say this, mind blowing for me. I don't know. It just had not been on my radar.
Yeah,
And
you don't think about it. Why would you? Yeah, it blows my mind still, and I lived it.
I want to shift gears because I'm excited about, for you, not the, yeah, the negative stuff isn't important. It really is. But having worked for the government for 5 years through the pandemic, done academia before then, and you're at this point where, yes, the job market is completely a mess, but it's also this crazy point in history where people are starting to understand the value of science communications. And especially in the health industry, you mentioned like your parents having to understand, one, English as not as a first language, two, in a small town where maybe doctors and health professionals had no idea how to handle your condition, or even explain it to them in ways that would make sense. Like health communications, I think, is probably people's first line of exposure to science communications. Doctors get bad reviews on Yelp if they're walking in and giving you a list of textbook terms to explain how you're feeling or what's going on with your body. So I guess all this to say, like, where do you see the field going, and then maybe how do you fit in?
I think, from 2020 on into now, with the many changes in the federal government's dealing of health, and like measles is going around, where the vaccines rule, things with vaccines are changing. There's raw milk. I think health is more at the forefront of people's like conversations, and it's top of mind more than ever for like, I think broader groups of people are talking about it loudly than we have seen before,
Hmm.
for better or for worse, because
Yeah,
some things are disinformation, and those folks tend to be the loudest, it seems.
I
But
was
no,
gonna say loud does not always equal qualified.
often does not. No, but I think, yeah, I think you're right. I think this work has always been important, but I think it's clearly now more important than ever. And people are hopefully, employers and companies are hopefully recognizing that the need to communicate well, and, to the right audiences at the right time in the right venue, and that they need people like you and me to do that. Um, so I'm hopeful that's kind of the wave, that there's the momentum for me to ride on eventually into a new job, because I would love to stay in this kind of work, and health science communications, whether that's for like working in-house for a company to help, share the great work they're doing, or back at a university, share what the researchers are doing, or like in more consulting agency capacity where I would be helping like a handful of companies or handful of clients to ultimately, I would think, do the same thing as put out, clear, accurate, helpful health information in these times, these
Yeah.
unprecedented times.
No, no.
Um, they're all and every day is unprecedented. I don't know if it's unprecedented
I'm so
anymore.
over it. Can we have precedented back? Yeah.
Bring
Yeah.
back, make America precedented again.
There's a shirt. Okay, yes, absolutely. Yeah.
Uh,
But like, I can't imagine how it must feel now. Ugh.
I have never experienced a job market like this one. It's crazy.
How many I feel like I saw a post or something. You said how many you had applied to so far since April 1st?
So I will say I took a break in June. I did not apply to any
Yes.
jobs in
Good for
June.
you. Yes, we love that for you.
No, I've applied to over 50 jobs. I'm applying for things I would actually want to say yes to if they gave me an offer, not just
Yeah.
to have a job. But yeah,
Yeah.
it's been 50 plus applications, and I've gotten like 3 interviews out of it.
Oh my.
Like I've been a like spokesperson for the FDA, then I could be, a spokesperson for your small hospital. If I've been a
Yeah.
spokesperson for Johns Hopkins Medicine, if
Right.
I've brought CNN through the OR, like I can go do that for your professional society. Like
Right. Yeah. Oh my gosh. Yeah. So that's something that I wanted to ask about when we got back to the topic of your most recent job, the FDA. There's so, the alphabet agencies, as they say. Like, I think right now there's always been probably some amount of skepticism about the alphabet agencies, the government agencies, and big government and all this. And obviously now there's quite a bit of scrutiny, I guess, because of the DOGE cuts and all these things. Can you just let's just take it back to basics. What is the FDA? What does it do? Why did you specifically want to work for the FDA?
Yeah, so the FDA, I'll have to fact check this, but I think if they regulate like 25 cents of every dollar that is spent in the US in terms of like, the products that exist in the ecosystem of the United States. So like foods, like over-the-counter drugs, prescription drugs, medical devices, so like pacemakers or even like the devices for insulin that like the continuous glucose monitor.
Yeah.
It's sunscreen. It's a whole array of things that the FDA, makes sure is safe and effective to put out on the market, and then continues to, monitor those things in case something goes wrong afterwards, in case there's a trend and they need to add new warning labels or perhaps move to take it off the market or, slap some companies on the wrist if they did something wrong. I think it's called enforcement, take enforcement steps. So that's what the FDA does in a very high level. And no, I wanted to work there at the time because the FDA is the agency that authorizes, at the time it was emergency use authorization, but approves the vaccines and drugs. So we were in the COVID times, that's the agency that was getting applications for, we never had a treatment for COVID, and they were reviewing those in like record time, working with the pharma companies to determine like who is this safe and effective for, what are the dosing regimens, how is this gonna be, how is it taken, is it a shot, is it a pill? They do all that work, and I wanted to be, part of seeing that and part of communicating this brand new thing.
Yeah, getting the word out and in a way that's accessible to people because there's where to start, so the FDA, going back to the first part of the question, what I'm hearing is the FDA is looking out for Americans, is protecting Americans and by saying, these products are okay, these are good to go, these are, safe to use, these are okay to have on a shelf and sell, versus things that I assume don't get approved, which either just hopefully, I don't know, go away, versus like, oh, they have to work at it. They have to get FDA approved. There's certain things that hoops they need to jump through, and like, I don't know. I'm not qualified to speak on this at all, but like I imagine there's, different when you hear about, oh, this is FDA approved now, it's not because someone waved a magic wand, it's because the FDA was working with that product or that company or that whatever to make it safer, make it easy, better for distribution for the everyday person. So
Like,
especially the COVID vaccine, I remember there being a lot of like, well, that was quick. Like, what's in this that they just like whipped, like acting like you guys or doctors or researchers were like in the backyard with the like mud potion. Like, I don't know, this is a vaccine. Like, no, this like, this was kind of already in the works. Yeah.
no, there's so much work that goes on in the background that I starting the job at FDA, working there for a while, I didn't even understand how much work went into making sure a product's approved, reviewing products. It's not just doctors in these very, specific fields of like infectious disease or pulmonary or, heart doctors. You also need statisticians on each team. You need people that know pharmacology, to understand, toxicology. So it's like a whole team of doctors and scientists and math people, pharmacists that are working like looking at every single word, and every little bit of the clinical trials data to make sure that, if something is FDA approved, that means like the FDA is going to stand behind it. It's been vetted with the best data that we had at the time, with the best scientists, on staff. So there's a lot of work that goes in the background. And we're like you said, if something doesn't say it doesn't get approved, sometimes that means like there's a manufacturing issue or they want more data. So it's like it's always a process, and like maybe you'll get approved in the next round if the company comes back and fixes whatever the issue was. But like things don't happen overnight. Um
And you don't want them to happen overnight if it's something you're putting on your skin or ingesting.
right,
Like,
yeah, putting in your eye drops. No.
yeah. Oh my gosh. Yeah, I think, not to be like a hopeless optimist, but I think one of hopefully the silver linings, the good things that comes out of this, almost like posthumously, the communicators and the communication styles are getting this makeover, because I think historically people didn't want to hear from the government. They want to know that they're getting what they need from it. But I think this whole thing that we're living through could be, not to use like a cliche, but like maybe it's the arrow being pulled back in order to get shot forward. Because I think like any even with COVID, so much amazing research came from COVID, not even just for the vaccine, the Hopkins map, the live map
Oh
for the
yeah, yeah.
COVID
I remember
infection rate, even like material science, like breakthroughs in like how to improve masks and PPE. All these things came of that COVID pandemic kind of experience. And I think this whole like this thing is happening because there has been such a disconnect between what the government does, who the government even is, and why it does the things it does, or approves or disapproves of whatever product is on the shelf. And I'm hoping that things are going to get better. Things are going to get better, and I think when they do, we're going to be so much more prepared for how to reach folks and get them the information that they need to get.
No, I hope you're
Ugh,
right. I think I read it somewhere that like people don't realize how much the government does until
it's
those
gone.
services don't exist anymore. I mean, even with like my team was eliminated, the press team at the FDA and I know the press teams at CDC and NIH were also eliminated, for the idea that HHS, our parent Health and Human Services, the parent organization for these smaller agencies. But
Mm,
you don't have, when you're in one office, you don't have the expertise for what FDA does versus what NIH does. You're not on the
yeah.
ground like me with the infectious disease department every day to know, like, oh, this drug was just approved. What does it mean? So if a reporter, like an FDA specific reporter, goes up and asks HHS, because they want to write a story about a new drug or some side effect of a drug, that knowledge isn't there. That connection isn't there anymore. So I think hope news stories aren't going to be the same. This
Yeah.
is just one example of something that's missing because like the FDA press team is gone.
Yeah.
NIH press team is gone. CDT press team is gone. So
Yeah.
I hope once people realize these things that are no longer there and how important they are, maybe we will get back to a place where we can
Yeah.
get them back.
Yeah. And I think to your point just then, like I think, I mean, and I am a huge fan of government agencies. I was applying actively for national parks jobs. Like that was the dream for me, and I didn't even know until the last couple of months that the HHS was maybe a thing and that all of the ones that you just mentioned, which I'm more familiar with, were housed underneath. So I
Mm-hmm.
think like if I'm confused about that, I can kind of see where this like distrust of like what are all these things even doing? They all do the same thing. Like I can kind of empathize with that point of view is coming from, and maybe that's part of it is going forward when things get better, because I'm going to be positive, making sure folks understand where things live and why they're nested under something else. And if you're a regular everyday person, health is health. So you don't necessarily see why there needs to be a CDC, an NIH, and an FDA, right? Like that.
Yeah, it's
I guess that,
confusing. I think,
yeah.
yeah, it's definitely confusing. And I think that criticism, like, oh, why are there so many things? Why are there so many people? That does apply to some parts of the government, right? Like we said earlier,
Right.
there's definitely waste and fraud in the government, like in any workplace, right? Like any place I've worked, there's definitely been things where I'm like, can we make this better? Like, why does this
Right.
exist?
Right. Yeah.
But I think that it could have been done like in a strategic way, a
Mhm.
thoughtful way, if people knew and understood why different things exist in separate places and what the
Mhm.
value of it staying that way is. So yeah, I think people just don't know what they don't know.
Yeah. When it comes to the government and politics and politicians, like they're not perfect, they're not untouchable. They're things that are active living organizations that need to be tweaked and looked at and evaluated and improved on. So not the best way for it to all come about, but again, hopefully it's just one big bump in the like making things better road, I guess.
I have to believe it. I have to believe that eventually things will balance out. FDA was the best place I ever worked, and I'll always grieve it and miss it. I think my former teammates will too, but I'm glad I got to experience what such a great workplace was for the nearly 5 years I was there because my bosses were great. Everyone I worked with was like a superstar. The work was meaningful.
They all wanted to be there, and they all were there for a reason, which was like everybody always has like a personal story. There's always a why there,
Yeah, everyone has a why. I think it's another part of why this layoff has been hard because like now we're all looking for jobs when we did not want to leave our previous jobs. And we're comparing every future job against this like amazing thing that we were
And I feel
part
like I'm seeing that again and again. It doesn't matter if it's a NOAA person posting about it and saying that. NOAA is the National Oceanic and Atmospheric Administration. I've seen NIH folks talking about it. It doesn't matter what agency has been hit. The reoccurring theme is this was my dream job. I loved what I did every day. I loved serving the constituents, serving the taxpayers, and finding ways to make things more efficient and better and get folks resources. And now I don't know what to do. And that I'm getting goosebumps right now. Like it breaks my heart. Like so the misunderstanding of like people in government work and why they're there and what they're doing. Hopefully this podcast is a drop
Yeah,
in the ocean of more stories like this that are going to come out.
you really have to. I feel like it's like being a doctor. Like being a doctor is not an easy job. So you really have to be in it for the right reasons. Like you have to want to do that work. And I think it's the same thing for people that worked in the government. Oftentimes the pay is lower. I mean, I was working with like medical doctors. They could have gone out and had their own private clinics and made way more money, but instead they chose to like work long hours reviewing drug applications, arguing with these companies, and for way less money. And you don't do that unless you really care about what you're doing.
That's
So
such
it's
a
just,
good point. That's such a good point. I'm out here, close to Silicon Valley, and the institution that I work for is heavy on the engineering, heavy on the tech, heavy on the data science. And it's, sometimes a struggle for recruitment because, like you just said, you have to want to do this work to to do it, because you could go down the street to Google and probably make it, we're talking about the difference between like 200,000 a year and 400,000 a year, in some instances. So it's like, I know those are hard. Those are just brain breaking numbers to begin with, but
right.
like
I'm like, I can't
that's,
even wrap my head around those numbers. So you have to really enjoy the mission to stay there.
Mhm.
I could have gone back to academia and been like, oh, look at this amazing research we're doing. Everyone's so happy.
Yeah, getting to work with students who are like so helpful and doing big
Yeah,
things and like
yeah.
whatever.
No,
Do you have like a win that you came home from and you like told your partner about, like, oh man, today so and so was confused about XYZ when it came to this product or the science, and I was able to answer that question, or I was able to clear it up, or do you have like any kind of like stories like that?
yeah, yeah. I think the one that pops up to mind first, probably because it was more recent, was like drug shortages. So I was the press officer for drug shortages, all the drugs. So there was the time when like the GLP-1 drugs like Wegovy, so
Hmm.
basically their semaglutide, tirzepatide were in shortage. And we have like a drug shortage database where we list when something is formally in shortage. But we also it can be listed as available, but still on the drug shortage site. So that confused a lot of reporters that were really looking into this story, because when a drug is in shortage, that opens up the doors for compounding to happen for the drug compounders to make the product. And compounded products are usually cheaper and more accessible. So that's a whole cost and patient access
Is
conversation.
that
But
the like generic? Is that the same thing as generic?
no, that's different.
Oh,
But like
okay.
the hims and hers and the rows, you probably saw like, oh, get semaglutide for cheaper than you could get it from, Eli Lilly or Novo Nordisk
Oh,
from
it's
the
like a
drug.
third party thing because, like, for instance, I'm on a GLP-1 and I get it through Weight Watchers. Like, I didn't go through my care, but I have to pay like my monthly Weight Watchers subscription or
Oh,
whatever the heck
interesting.
membership.
Yeah. There's a
Yeah.
whole ecosystem for it, but I think for a while, because those drugs were formerly in shortage, as the way FDA defines it, that opens up the door for compounding. And because, like I said, there were so many aspects to this whole situation, the reporters were really like keeping an eye on what does this mean? When will the drugs be off shortage? Does that stop compounding? Will patients lose access to their drugs? So, anyways, there was a time when it was still in shortage, but is listed as available on our website, which is like rightfully kind of confusing.
Right.
So, I spent a lot of time talking to reporters, explaining what that means. And what that meant was that it is still technically in shortage. It could be available, but that means that the back stock has not been filled yet, like the back order
Oh,
supply. So they don't want to take it off the shortage list if the back stock and stuff hasn't been filled, because then it could just go back on the shortage list like the next day. So, they'll say it's available, but it's not fully off the shortage list. Yes. Yes. So because it's not fully off the shortage list yet, companies can still compound the drug like per the laws and regulations. So I spent a lot of time explaining that to reporters or correcting them because some reporters just ran with, "Oh, it's available now." So I was really proud of that, like, because that's a lot of the like personal time you put in, like calling,
Yeah.
"Hey, off the record, like this is what it means. Here's the nuance."
So were you having to like keep tabs on all these stories that were coming out and then like, oh nope, this is wrong, I gotta call them? Was
I
that
would
like
I would keep tabs, but not like too aggressively.
okay.
You sometimes would point out like because we would get news clips, so I would kind of go through those, but I would not like search
Okay,
for.
cool. I was like, that just sounds like a lot of
No,
tracking. Like that was like that sounds like a crazy amount. It probably still was a crazy amount of
yeah,
work though. Oh my gosh. Yeah, that's
there's
good.
just
And
stuff
then
like that.
helping because you're not just helping like reporters, you're helping the people that were looking for that information in the first place
Yeah,
to
exactly.
to
Like
like
people are like, what's gonna happen to my drug? Or just shortages in general. I think there was, a time when like a lot of chemo drugs were in shortage, ADHD
ADHD.
drugs.
Yeah.
I don't know. They probably still are in shortage. I don't
Yeah.
know.
It's been a mess. I know it's been a mess for a lot of people. Yeah.
It's been a mess. So there was a couple years where the news cycle was really focused on, those specific drugs and what it meant and like what is a drug shortage. I feel like it entered the common vernacular more. And so people often are like, why doesn't the FDA just make companies make more drugs? So, there was a lot of work that we put in getting my experts out on the news to explain like by law, this is what the FDA can do to help with drug shortages. Here's what we cannot do. Like, we are not
Right.
a drug company. We can't go and make more product. We can't make them make more product. Which,
Yeah.
it sounds goofy. It sounds kind of like, duh, now that I'm saying it this way. But like if a normal person hears, oh, drug shortages are defined by the FDA, maybe I don't guess it's not too unreasonable to be like, why can't the FDA fix it?
Well, especially when you're, getting close to being out of your drug that you really need, or you are out of it, or you've been trying to function for a couple months without it, or something like that. Like that, yeah. Of course, you're just going to be like government agency. They have to know what's going on. Like this is all their fault, or it's like you were literally just there to make sure people were getting the information that they really needed to get, and that it was accurate, and to I don't know, just like help things in the bigger picture. It's like the
Yeah,
missing link almost.
and I think by doing that, that helps people focus their energies too to being able to solve their problems. Like if they understand, oh, it's not this entity that is, in charge of drug pricing or availability of certain things, but like I could speak to my Congress people if they can change the law for this, or if I could, look into talk to my health insurance company for the pricing issue.
Like,
Yeah.
yeah, I love that. I think that those when I have those kind of days, that's like definitely where I'm like, I'm doing the thing. Like this is what I signed up to do. The last question I have, and I know it's like it's a question that I've been struggling to answer myself. I have some folks that I worked with at Johns Hopkins University who are now like finished a master's and they're headed out into the world. And I have cousins and, that are women in STEM. Woohoo. What advice do you have for somebody that's going into this field? Or maybe they didn't know this field existed before. What advice do you have for them? I guess, especially right now in this climate, and what message do you want to send to them right now? It's okay. You can be real about it. Sorry.
So I don't have anything encouraging to say in terms of actually finding a job. I do think the work is still needed, like overall, philosophically, I think there's the need.
Yeah.
And I would say, yeah, you absolutely don't need a science background. Definitely not a PhD to do it. I think some people have argued that the best science communicators sometimes are the ones without a science background. I think just making sure you have like clips to show, like writing samples, even if it's not from a real internship or job. If you're starting from scratch, then just start a blog, write about something that you're interested in, put yourself out there, like create those clips in whatever way you can, like make a podcast
Yeah.
like this, right?
Yeah. Yeah, exactly. Get the content out there. It doesn't, like the sooner it's out there, and I'm saying this before I've even launched, the sooner it's out there, the sooner you can get feedback on it and you can start honing those skills
Yeah,
and
absolutely. Like, I think that would be my best advice. There's a lot of professional organizations like National Association of Science Writers that folks could join to find mentors. I just to say, it's all about in this line of work, I think, willing to feel stupid and to look stupid when you go out and talk to, because you're going to be talking to a scientist with PhDs. You're going to be talking to someone like at Hopkins with MD, PhD, JD. Like,
oh my gosh.
of course you're going to be stupid. You are compared to,
Right.
like, we are, right? Like, but don't be afraid. Like, you ask the questions, ask until you get an answer that, explains the concept you're trying to explain in a way that other people understand. Just always having like I think in this line of work, you kind of have to just be a nerd because you have to enjoy the work because you always have to be curious to learn new things all the time.
Yeah, I think like you just said, I think be curious you can't go wrong. It doesn't matter what the situation, the scenario is we're talking about, like be curious and then, being okay with looking dumb. I love that so much. Like I think it doesn't matter what it is. Trying a new kind of workout, trying to maybe ride a bike because you never learned as a kid, whatever, just like be okay with not being an expert in something and be okay with the fact that somebody else might know more than you on a topic. And
Yeah, that's life advice in general. Like, I mean, as we get to our old age, right? We're like, it's not that serious. Like,
right.
no one is judging you more than yourself.
Oh my gosh. Yes, that another t-shirt right there. Oh my gosh. Totally. Do you have like a favorite science myth or pseudoscience that you've either heard a lot or had to debunk yourself a lot? I'm sure you have so many because of the phone calls and emails you've had to address in your previous job, but do you have like one that like either haunts you and follows you everywhere or like that you have fun debunking?
I think my favorite one was we folks really wanted ivermectin to either treat or prevent COVID, and all the available data. We're looking into it, but it doesn't seem like it works that way. But when Paxlovid, the oral COVID treatment, it's like
Oh,
yeah, it's the
the
pills. But
pill.
when that was authorized by the FDA, it was the first like oral. I think it was the first or second oral option because before that, everything was just like you have to go to an infusion clinic to treat COVID. I got a few media inquiries that were like, "Is Paxlovid just ivermectin that was repackaged?" Like it's like the conspiracy was that we the ivermectin does work, but the big pharma big pharma and FDA did not want to admit to that, so we repackaged ivermectin as a different drug to sell and help this drug company.
People go to lengths. The lengths that the folks go to feel control over a situation, man.
It was just so fun because you're like, what do you like? No, it's not. Like, what do you want me to like? How else? It's oftentimes that job felt like no matter what you say, someone's gonna be upset and they're not gonna believe you.
I guess
So
that's more life advice, right?
you
Like,
skin and laugh about it. Like,
wow. Yeah, like I didn't even think about that's like a loaded question to ask you for sure because of all the things that you had to deal with, especially at the time in history where you were there. Oh my gosh.
yeah, it's just, you can't win.
Like, ultimately, it's folks have big feelings about stuff, and 9 times out of 10, it's even if they're coming at you with some crazy pseudoscience they got from some influencer, that it's coming from a place of fear or concern or very real for that person anxiety. And I think that's how a lot of these like pseudosciences take hold, is that ultimately at the end of the day people are just they're scared or they're worried or they want what's best for them or their kid or whatever. So I'm glad that I'm glad that one day when we have these services again, people like you are able to like validate the concern, but get them the right information.
Yeah. Yeah, no,
My
and
gosh.
I'm really glad you said that because I think that's true. I think it's easy to feel cynical that people, are coming at you with aggressively because, angrily and like uninformed. It's easy to write them off sometimes, but you're right. People are just coming in because they want the best for their health, the health of their loved ones, and they're afraid, or maybe they're only getting information from certain sources, and if those sources are all saying the same thing and the government's saying something else, like it seems, kind of like, well, who's the outlier here? It's the
Yeah.
government.
It's tricky.
Um,
Yeah. And I don't like doing my taxes and I don't like getting speeding tickets. So therefore, I'm going to go with these harmless
right.
influencers.
Like, I don't either, buddy.
Yeah, truly. What do you wish more Americans knew about your field and the work that you do?
I think sometimes there's the misconception that people that work in like public relations, public affairs, media relations, that space, like that go between an institution or an entity and reporters, that we're like spin doctors, that we're only loyal to the institutions that we work for. We're only hawking things for Johns Hopkins. We're only, we're saying very certain talking points for the government, and we're trying to like sell fake news to reporters. But I think, kind of like I said earlier, I view it more as like we're bridging a gap, right? Without us, scientists or the people at the institutions we work with don't know how to communicate to a reporter. Like, sure, yeah, you can put them together and then, but if they're not speaking the same language, what is the good in that? So I think like the work, I want people to understand the work that folks like me do is I help a reporter understand, like we need more time to answer your questions. Like this is what's going to get the best results for both of us, kind of making those negotiations and helping media train like a scientist that is like we talked about has been trained to communicate in a totally different way. Like I bring the outside perspective to be like, actually this is what you're going to be asked, how, like, I'm not training you to say a certain thing. I'm training you, I'm helping you say what you want to say in a way that's actually gonna be received.
Yeah.
That's actually gonna, like I'm trying to help you accomplish something here. And I think I want people to understand the value in PR, media relations work.
Yeah, absolutely. Yeah, we're not just like these aren't parrots. We're not training them to give,
No, absolutely not. And you could ask like the doctors I've worked with, because that's the thing of being in PR. Like both sides are annoyed with you, also. Like like it's not like all these doctors are like, yes, put out my talking points to New York Times. It's like no, New York Times is also annoyed with me, and my doctors are annoyed with me. But what I'm trying to do is put out like accurate info in a way that people actually will read.
right. Like can understand and will choose to read. Yeah, that's like oh, amazing. Yeah, I love that. I think that really speaks to I don't know. Again, this podcast is we're gonna talk to all kinds of people. We're gonna talk to people with all kinds of jobs and from different backgrounds. But clearly, I have a bias, and I know a lot of people in the science communications kind of realm, if you will. And I think what you just said really speaks to the special qualities you have to go in and make sure that like you said, not everyone's going to be happy sometimes. And, the two parties you cared the most about, the scientists and getting the science right for them, but also the press and getting the headline that will get the most eyeballs on it or whatever. Like it's it's a very, I don't know, you got to be like Elastigirl or something.
I mean, in my sign off email, the day I got laid off, I sent an email to the reporters that I was like worked with the most. It's probably
Yeah.
like a group of like 30, 40 of them. And I was like, if you ever found me obtuse or you found my answers to be like unsatisfactory, like please know, like I tried my best. I tried my best to like, I advocated for like more interviews and like clearer answers, all without breaking the law. So like But you don't want to make stuff, you can't make stuff up either
Right.
and just say whatever to USA Today.
Hmm.
So it's an interesting job for sure.
Well, I know wherever you end up next, they're going to be so lucky to have you. Um, just, I can't imagine having a dream job like that and getting to work with, you just casually rattled off like, New York Times and USA Today. That's amazing. You're so talented. You're so empathetic. You've been through so much to make you perfect for that kind of a role. And I know you're going to land on your feet, and I'm going to send you all the good vibes for people to answer your emails and your applications, because I know you're doing the work. So, but thank you so much for joining us today. And I'm sure there will be a time where I'm bothering you again. Wherever you go next, we're going to have to talk about that too, obviously. So
Oh yeah, obviously. Anytime. Thanks so much for having me.
I'm so happy we got to catch up. And yeah, thank you for hanging out today on Blue Collar White Coat.
Love it. Thank you.
What I love about Chanapa's story is how much it reminds us that science isn't always some abstract, intangible thing or some subject in school. It's people. People with families, struggles, and a deep commitment to getting it right. From navigating the chaos of the pandemic on the front lines to making sure critical information about everyday prescription medications reaches the people who need it most, her work at the FDA shows just how nuanced science can be and how incredibly important trust is to communicating effectively with the public. And I am happy to report that since this conversation was recorded, Chanapa has successfully landed yet another dream job as Senior Vice President of Health Media for Edelman Public Relations. In her new role, she gets to work closely with media teams like the ABC News Medical Unit that she forged relationships with during her time at the FDA. So it just goes to show you that everything Chanapa and I talked about in this episode, working hard, being genuine, and getting comfortable being a little uncomfortable, really goes a long way to putting you into situations you could have never imagined yourself before. On the next episode, you'll hear from, well, me. I'll be telling you my own story, how I got into science, where my career has taken me, the challenges I've overcome, the amazing experiences I've had, and what makes me uniquely qualified to do my job as a science communicator and host a podcast like this. Don't worry, there are more episodes to come after that, with guests from New York Times featured underwater photographers to horror-loving morticians. So if you like what you hear, be sure to follow our show and subscribe on your podcast platform of choice. Have an idea for an episode? A job you want to hear more about? Or do you want to be on the show yourself? Shoot us an email at bluecollarwhitecoatpod@gmail.com. Don't forget to subscribe to the show on your podcast platform of choice and follow us on Facebook, Instagram, and TikTok at Blue Collar White Coat Pod. Thank you so much for the support, and until next time, keep your safety glasses on and your mind open.